Hi everyone, I'm Nadia Farrell Peanut, Head of the Adult Education Division.
Hi, my name is Miss Roach. I'm the Minister Secretary for Ministry of Governance.
Hi, I'm Consuelo Warrington, Administrative Assistant at the Establishment Personnel and Training Department.
Hi, I'm Shamin Thomas from the Ministry of Governance.
Hi, I'm Verna John Baptiste, Senior Clerk, Establishment Personnel and Training Department.
Hi, I'm Emmeline Augustine, Establishment. Just wanted to know that
I got vaccinated.
I got vaxxed.
I got vaccinated. I got vaccinated.
I got vaccinated.
I got vaxxed.
And I encourage you to get vaccinated.
Take the vaccine. Take the vaccine.
Throughout history, humankind has prevailed in our darkest moments, coming together to face the very thing that would extinguish our light. This is not one of those moments at all. This is a moment for pretty much the opposite. For hiding, for laying low. Napping is also good. Saving humankind by really not getting near it. Where playing games, staring at screens, staring at anything, all are the stuff of heroes. Every generation has its moment, where individual sacrifice makes way for the good of those who will come after. A higher purpose. This one is ours.
Hi, my name is Mr. Benji, Cultural Ambassador and lead singer for TK International. Covid-19 has hit my livelihood very hard. No large crowds means no shows. No live performances means no zero. I want to get back to doing what I love, to what you love. Let's get back to 13. I can only get back on stage if we all take the vaccine. Get vaxxed. Mr. Benji said so.
Good evening. Epidemiologist and the health coordinator of the Eastern Caribbean Conference of the Seventh-day Adventists, Mrs. Priscilla Prevost. So to get this evening's briefing started, I would like to welcome Dr. Ahmed.
Good evening to everyone. I acknowledge the presence of Mrs. Priscilla Prevost, Health Coordinator of the Eastern Caribbean Conference of the Seventh-day Adventist. And okay, to start with our COVID-19 status update for Dominica. As at September 7th, 2021, total number of new cases, 68. Total active cases, 494. Of these 494, 15 are PCR positive cases, and 479 are rapid antigen positive cases. Total recovered cases, 1,675. Total COVID-associated deaths, 6. Total number of people tested, 56,462. Of them, 25,248 PCR tests and 31,214 rapid antigen tests. Our vaccine coverage, 49% of our adult population took at least one dose of the vaccine, and 44% of our target population are now fully vaccinated. Let's look at the daily trend starting from July 28th to September 7th. The bar graph represents daily number of positive cases. That's tested by rapid antigen test. And then line graph represents weekly average. If you notice, those bar graph has a certain pattern. Actually, it starts on Monday pretty high, and then as the day progresses during the week, it actually decreases a bit. So I have averaged those week and provided you that information. So the week 1, we had only 1 case per day. Then on week 2, we had jump into 20 cases per day for that week 2. And then week 3 and 4, on average per day, we had 60 cases. And then week 5th, it went up to 66 cases per day for entire week of week 5th. And then week 6th, it came down to 55 cases. And as of yesterday, our total number of cases actually 33% less than the previous day. Okay, let's look at the proportion of vaccinated and unvaccinated COVID cases. Previously, I have presented the total number of cases on that occasion were 1,107. Today, we have added more cases, about 1,385 cases. But the percentage of vaccinated and unvaccinated of COVID cases remain the same, pretty much the same. It used to be 75% unvaccinated, but this week is 76%, 1% even higher. So 76% are unvaccinated COVID cases. Let's go through this table and look at each of those age group. Less than 18 years age group. We have total positive cases 260 of these 1,385. Just to remind you, this under 18 years age group represents roughly about 33% of our population. Whereas 18 to 35 years, our young adult age group, we had 509 cases. And 36 to 65 years, which is our middle age group, also had 509 cases. So these two age groups, 18 to 65 years age group, represents roughly about 60% of our population. On the other hand, 66 and up age group represents roughly about 8% of our population. And of them, we had total antigen positive cases 107. And if you look at the proportion of unvaccinated antigen positive COVID cases, the age group that we have, total unvaccinated percentage of unvaccinated cases now is 76%. Let's look at the other graph, which I'll explain much better as to in terms of comparison to vaccinated versus unvaccinated. So this is the chart representation of the table that I just presented. So under 18 years, of course, they're unvaccinated. So the 18 and 35 years and 36 and 65 years age group had roughly about 77% and 70% vaccinated, 70% unvaccinated positive COVID cases. So these two groups, we can pretty much say they are holding, they're fighting. Their immunity is good enough, 70% against 25%. On the other hand, we have to be careful the age group of 65 years age group, whereas breakthrough rate is much higher, close to 46%. But in total, nationally, the percentage of vaccinated against unvaccinated remain 76 to 24%. Okay, let's look at our deaths. To date, we had 6 deaths, all 6 of them during this surge. So death 1 occurred on August 14th, 2021. The death one was 46 years old female. She had comorbid condition of diabetes. She was unvaccinated, and she was diagnosed on August 11th. Peculiar of this case was that she did not present any flu-like illness during her admission, and most of her stay at the quarantine facility. On the day that she died, her blood sugar was very high, and it was told that she did not adhere to diabetic medication. Let's look at second death and third death. Both deaths occurred on August 26th, 2021. One of them is 78 years old male. He was diabetic and hypertensive. He was unvaccinated. He was diagnosed on August 15th. The second gentleman was 70-year-old male. He was diabetic as well, unvaccinated. He was diagnosed on August 7th. His PCR was repeated before he died on August 16th, and it was negative. Case number 4. Case number 4 died on August 27th, 2021. She is 74-year-old female. She was diabetic and hypertensive. She was unvaccinated, and she was diagnosed August 20th. Our 5th case died on September 2nd, 2021. She was 95 years old, and she was hypertensive, unvaccinated. Our 6th case died on September 5th, 2021. He was 93-year-old male. He was diabetic and hypertensive, unvaccinated. So the summary of these 6 deaths include 3 males, 3 females. Their age range 46 to 95 years old. Their median age is 76 years. Their vaccinated status, all 6 were unvaccinated. Comorbid conditions, one only diabetic, 2 of them were only hypertensive, and 3 were both diabetic and hypertensive. So in summary, total number of COVID cases for the period of July 28 to September 7th is about 1,965 cases. Number of new cases are about 33% less than the previous day. On average, we have 55 new cases per day for the past week, as compared to 66 cases in the previous week. The unvaccinated group, 76%, remains the main contributor to this surge. All 6 deaths were unvaccinated. With this, I thank you and have a good night.
Thank you, Dr. Ahmed. To recap, as of today, we have 68 new cases on island and 494 active COVID-19 cases. In terms of vaccinations, 44% of the population is currently fully vaccinated. At this point, I would like to welcome Mrs. Priscilla Prevost.
Ms. Vanella Ole, Communication Officer, Ministry of Governance, Public Service Reform, Citizen Empowerment, Social Justice, and Ecclesiastical Affairs. Dr. Epidemiologist, Dr. Sholadeen Ahmed, our viewing and listening audience, pleasant good evening. I'm Ms. Priscilla Prevost, Health and Wellness Consultant and Health Coordinator for the East Caribbean Conference of Seventh-day Adventists. This evening, as we observe the month of the elderly in September, I am here to share with you on care of the elderly during this COVID-19 pandemic. Around the world and here in Dominica, we have seen firsthand the impact of COVID-19 on our elderly. The global and regional statistics show that the elderly are more susceptible to contracting the virus, suffering severe illness and death. As you just heard from Dr. Ahmed, Dominica has recorded 6 COVID-19 deaths. Within, 6 weeks since our surge. 5 of these 6 deaths have been individuals over the age of 70 years, with the eldest being 95 years old. Providing care and support to the elderly or older persons during this COVID-19 pandemic should therefore be the concern of everyone, but in particular, caregivers, family members, and the wider community. The elderly by nature of their age, they are more vulnerable to infectious diseases generally than any other age group due to their physiological changes which takes place at that stage of life. Their immune system and hence their immune response are not as effective as they were when younger. It is also well established that many of the elderly are likely to have one or more of the non-communicable disease or comorbid conditions like diabetes, cardiovascular disease, or hypertension, making them at higher risk for negative outcome should they contract COVID-19. And you saw that, you heard that quite clearly from Dr. Ahmed in his presentation a while ago, that the 6 deaths, all of them had comorbid conditions, and diabetes and hypertension were among the most striking ones. People who age healthily are at less risk of developing severe illness. Therefore, maintaining a healthy lifestyle is an important consideration for every one of us. And while we are managing the COVID-19 pandemic, it is important that we pay attention to the non-communicable diseases, preventing as well as managing and, where possible, reversing those conditions. There are 3 types of seniors: the dependents, the independent, the semi-dependent, and the dependent. Regardless to what level or what type of elderly or seniors we are referring to tonight, I would like to remind us that it is necessary that attention be paid to every aspect of caregiving for these seniors or these elderly. First, we look at the general care. This includes having regular baths, looking after their oral hygiene, hydration, physical activity, and good nutrition. Some of the seniors may be able to do these for themselves if they are in the category of the independent seniors. But those who are probably semi-dependent, but those who are dependent, these activities need to be provided for these individuals. Maintaining hydration is very important. Some seniors, elderly, they do not like to drink water. And they may only drink water when they have to take medication, if they are on medication. So it is important that we ensure that they have 6 to 8 glasses of water daily. A balanced diet is also very important at this stage. And by a balanced diet, we mean having foods from the various food groups, ensuring that they have their carbohydrate to provide energy, their protein to help repair their tissues, their vitamins and minerals, fats to minimal, and also the water, which I mentioned already. Some may need additional supplements, like vitamin C, if they are not able to eat properly or their nutritional status is not up to standard. Hygiene and infection control is important. For the semi-dependent and the dependent who requires close contact by caregivers, it is important that caregivers follow all the protocols. The use of personal protective equipment is necessary. And in fact, the mask must be used, and I must emphasize that the mask must be used appropriately at all times. And this is very important. We see people using the mask, but not using it appropriately. Hand washing is very important. Hand washing for at least 40 seconds, or the use of alcohol-based hand sanitizers before attending to the elderly is important. As we have already noted, that many of the elderly are experiencing or have a diagnosis of one or more non-communicable disease, and therefore would be on medication. Compliance to medication is important. Persons using medication need to be supervised and encourage compliance. This goes along with close monitoring, especially persons who are on treatment like on insulin. Their blood sugar should be monitored regularly. In fact, I recommend that the clients or the relatives should obtain or purchase a blood sugar monitor to monitor these individuals at home. Don't just depend upon the nurse or the health center to do those tests. These are things that should be available at home for each person. A blood sugar monitor and a blood pressure monitor where these vitals can be checked and recorded. And of course, if it is noticed that there is any significant change, either significant elevation or a significant drop in the blood sugar, that would probably lead to the person going into a coma or something of that nature, then you need to contact the health nurse, the district nurse, or the nurse practitioner, your doctor, but somebody need to be contacted. Avoid smoking. And we know that there are some elderly who smoke, and they should be informed that at this stage with COVID-19, persons who smoke are at greater risk of developing severe illness from COVID as a result of smoking. And according to WHO, smokers have up to 50% risk of developing severe illness and death from COVID-19. Alcohol is known also to weaken the immune system and should be avoided. It is also very important that we restrict visitors to a large extent for the seniors. We need to protect the elderly from having close contact with visitors. If we understand how COVID-19, how the virus is transmitted, usually the transmission is greater within families in homes, because the elderly do not go out, but families go out, or even visitors who may come in, you are not sure who they have been in contact with, and some persons may be in contact with people who are infected that they are not even aware of. So avoiding visitors is important. However, we can pass by the elderly and call them, let them know that you are remembering them or you are thinking of them, and find out how they are doing. You can call them on the phone and let them know that you care, and if they have any concerns, any needs, that you or someone else would be able to provide those needs for them. As much as you love your grandparents, talking to grandchildren, as much as you love your grandparents, now is not the time for close contact, which includes touching, kissing, and hugging. As I said, you may be in contact with a positive case that you are not aware of. Physical distance does not mean social isolation. So even if we ask for physical distancing or social distancing, it doesn't mean social isolation. So social engagement is important. The theme of the month for the elderly is older persons embracing the digital age. I recall my mother, when she was alive a few years ago, while I was studying, she asked me for my book, and I told her, no, my homework or my studies on my computer. She told me, go and get the computer. And I actually went and I brought it. And when I brought it, she laughed, and I just recall that she had indicated that she wanted to learn to type just a few years before. So we need to embrace technology, right, even during this COVID-19 pandemic. And the elderly can stay in touch with family, with friends, with loved ones. Many of them have relatives overseas and would be happy to be able to connect with them either via Zoom, via WhatsApp, via FaceTime, or whatever technology that is available. So teach them how to use. Set up Zoom for them and show them how to use it. They would be happy for that. They can access religious services on the radio, on the television, or even online, even via Zoom. A very important consideration at this time is, because of the high risk for COVID-19 and the negative outcome from same, it is important that the elderly, along with those who care for them, their caregivers, get vaccinated. And you heard the report tonight that those who have been affected by COVID-19, we have the percentage of unvaccinated is 77% unvaccinated and 24% vaccinated. So it is important that, and the elderly, all those who died here in Dominica were unvaccinated. So vaccination is important. Vaccination during a pandemic is not just a personal issue, and I want to underscore this tonight. It is not just a personal issue. No man is an island. We live with family. We live in community. We travel on public transportation, some of us. We go to church, well, at least not right now, or yes, coming soon. It means we mingle with people at some point. The coronavirus has no face. Anyone could be carrying it. Guess what? Granny or grandpa has they have not gone out. They are at home. How did they get COVID? It was brought to them at home. I would like you to give this some thought and let it sink in. This evening, I am appealing to all caregivers, healthcare workers, family members, and community members who interact and provide care to the elderly. You may be young and healthy and in a better position to deal with the effects of COVID-19. But the 70, 80, or 90-year-old that you live with or care for will not stand the same chance. It is only fair that you do what you must do to protect them at all costs. And I'm repeating again, that we do all that we should do to protect the elderly at all costs. It is really not fair. It is only fair that you do what you must do to protect them at all costs. Contact your health team and get them vaccinated. You as well should get tested regularly and vaccinated to offer another layer of protection. Some elderly who live alone may need assistance in collecting groceries, paying bills, or collecting medication. I don't think we should allow these individuals to be out in the public accessing those services. Relatives, neighbors, or friends should step up to provide such services while maintaining the protocols. Protect the mental and emotional health of the elderly. Encourage positive thoughts and spare them the scare tactics from conspiracy theories. Ensure they have the correct information about COVID. Philippians 4:8 in the New King James Version tells us, "Finally, brethren, whatsoever things are true, whatsoever things are noble, whatsoever things are just, whatsoever things are pure, whatsoever things are lovely, whatsoever things of good report, if there is any virtue, or if there is any praiseworthy, meditate on these things." We are also reminded by the Apostle Paul in 2 Timothy 2 verse 7, the New King James Version, "For God has not given us a spirit of fear, but of power, of love, and of a sound mind." Therefore, whatever our communication with the elderly should be of a nature that will help them to think positively, help them to be calm, to relax, and not to be frightened or afraid or scared, based on what is happening at this time. Maintain your spiritual connection and encourage the elderly to do the same. Provide spiritual material, music, or online religious services. Encourage connection with their faith community. Pray with and for them, and be prepared to follow God's guidance and accept what He has provided. As I close, let me remind you that all older people's lives are as important as ours and should be treated with respect and dignity. Thanks for listening. Have a pleasant night.
Thank you, Mrs. Prevost. As was stated, it is important that we adequately care for our elderly. Hydration, nutrition, proper hygiene, medication, the health protocols, all important in adequately caring for the elderly. I want to remind the public that the Ministry of Health's short video competition is officially on. I urge you to visit the Facebook page to like and share videos. And as always, I want to encourage you to follow all health protocols implemented by the government of Dominica, to get tested and to get vaccinated. Thank you for joining us. Good evening.
Hi everyone, I'm Nadia Farrell Peanut, Head of the Adult Education Division.
Hi, my name is Miss Roach. I'm the Minister Secretary for Ministry of Governance.
Hi, I'm Consuelo Warrington, Administrative Assistant at the Establishment Personnel and Training Department.
Hi, I'm Shamin Thomas from the Ministry of Governance.
Hi, I'm Bruna Jean-Baptiste, Senior Clerk, Establishment Personnel and Training Department.
Hi, I'm Emmeline Augustine, Establishment. Just wanted to know that
I got vaccinated. I got vaxxed.
I got vaccinated. I got vaccinated.
I got vaccinated.
I got vaxxed.
And I encourage you to get vaccinated.
Take the vaccine. Take